So again, I'm Hillary Ritt. I'm the Workforce and Adult Services Consultant with the Kentucky Department for Libraries and Archives. This webinar today is Social Work Interns in Public Libraries. I'm pleased to have Dr. Beth Waller here today, along with Dr. Rebecca Bloomer and Ahmed Farah, in addition to, I think, some social work interns who have worked at the Louisville Free Public Library as part of their program that they have offered. So want to now turn it over to Dr. Beth Waller. Please note that this webinar is being recorded, and the slides for this webinar are available in Blackboard Learn under the PDF and slide section in the Blackboard Learn window. Captions are available a couple of ways. I'm going to drop that in the chat here again, and so that you can access those. Give me just a second, I'll put that in the chat. And then if you have any technical questions or need assistance, you're welcome to type that in the chat. And I've also put some technical help, a link to tech help in the chat as well. So without further ado, I'm going to turn it over to Dr. Waller. Thank you all.
Thank you so much, Hillary. I'm really happy to be here with everybody this morning and to talk about—
Dr. Waller, I think you're muted. I'm not able to hear you.
Oh no.
I was hearing you, Dr. Waller.
Okay. Yeah, it says it's not muted.
Okay. Great. Thank you, Melissa.
Okay.
Kim, Usri, are you able to hear her? We'll make sure the recording is going to come through okay. Okay, great.
Okay. Thank you. Let me know as I'm talking if something happens and you can't hear. But I'm happy to be here with everybody today and to talk about social work internships in public libraries. There's really growing interest in this topic around the country and also internationally in some other countries as well. And so I'm going to start by introducing myself, and then I'm going to let our other two co-presenters also introduce themselves. And then I'm going to talk more in general about social work in libraries and why this movement is happening and what kinds of things social workers do in libraries. And then our other co-presenters are going to talk specifically about what has happened there at Louisville Free Public Library. And then we'll talk about some steps that all of you can take if you're interested in having social work interns in your library as well. So just to introduce myself first, I'm a social work professor. I happen to be the director of the School of Social Work at the University of North Carolina at Charlotte. I also am a researcher and a consultant. My research focuses specifically on library patrons' psychosocial needs, library staff needs in terms of serving high needs patrons and dealing with work-related trauma. My work also focuses on trauma-informed librarianship, social work collaborations, and then other kinds of partnerships, services, or programs to help meet these kinds of needs. I do have a consulting business called Beth Waller Consulting, where I work solely with public libraries around the country who need needs assessments or are trying to pilot some sort of social work collaboration or other type of program or service to meet their patron or their staff needs. And then I also do training as part of my consulting business. And then before I became a researcher and a consultant and a professor, I have about 14 years of practice experience in the state of Kentucky. I'm actually from Kentucky originally. And so all my practice experience is there, working specifically with people who have poverty-related challenges, who were experiencing housing instability or homelessness, who had substance use disorders, mental health problems, or other things that were considered barriers to economic stability and mobility, which is how I wound up originally working with libraries, was because most of my practice experience in social work really overlapped with the challenges that most libraries are now seeing with their patron populations. I also have a book that's coming out this summer called Creating a Person-Centered Library, Best Practices for Supporting High Needs Patrons. It's supposed to be published sometime around August or September, and it's co-authored with Sarah Johnson, who some of you may also know her name because she's worked largely with social work internships and done a lot of research in that area as well about library-based social work interns. So I'll turn it over to Dr. Bloomer to introduce yourself.
Hi, can everyone hear me? Great. My name is Dr. Rebecca Bloomer. I am a social work educator. I do some consulting on the side as well as research and training. My research is really focused a lot on community-based spaces and using third spaces for enhancing community well-being. I also research social justice youth development and work heavily with immigrant and refugee communities using different types of community-based research methods. And then my practice experience in social work is with youth and families and community-based programs, out of school time programs, and looking at programs where they intersect with social work and education. I also spent an extensive amount of time working in the field office at the University of Louisville. So I have some knowledge about the way that social work practicum internships work and kind of what the needs of students in those placements are. So I'll turn it over to Ahmed.
Let's see. Do you all hear me?
Yes, sir.
Okay. Hello, everyone. My name is Ahmed Farah. I am a master's level social worker. I've received both my bachelor's and master's in social work, and I've had experience in providing, of course, direct services with individuals and families, but also non-traditional and traditional. So traditional would obviously be maybe working with child protective services. Non-traditional would be working in a library setting. I have experience in working with children and families as a caseworker with the Department for Community-Based Services, which is child protective services. I've also done some foster care as well. And I've also worked with those who are dealing with, of course, mental and behavior challenges, including substance use disorders, whether with those who are unhoused, especially those who are chronically unhoused, but also those who are housed who do not have any issues with that. I currently work as the Immigrant and Refugee Services Coordinator with the Louisville Free Public Library. I provide both outreach and programming. Outreach would be, of course, the traditional type where we would go to immigrant serving agencies, but also non-traditional type where I would go to apartment complexes where those who are immigrant or refugee reside. I've done some trainings with LFPL, of course, in relation to how to work with immigrants and refugees in a library setting in terms of understanding the different cultural aspects of these individuals and maybe how to make them feel more comfortable, more welcome in the library. I pass it back to you, Beth.
Thank you. So today, again, we're going to just give some broad information first about the roles of social workers in libraries and what kinds of partnerships and collaborations are happening nationally. We're going to talk specifically about how social work students can be used to help libraries with some of the patron and staff needs that are coming up right now. We're going to talk about some common challenges of hosting library-based social work students, and then give you some information about how to partner in your own areas if you're interested in hosting a student. And you'll hear a lot about the lessons learned from LFPL from their first practicum placements this past academic year. So just broadly, I'm going to cover this really quickly because we have a lot to cover today, but I do want to give some background information for anyone here who may not be aware of some of the research about the growing psychosocial needs and how social workers are helping with these things in libraries. But there have been a lot of historical changes that have happened in the US over the last few decades that have led to some changes in the patron populations that are coming through the door of a public library. And the first one was the deinstitutionalization movement that started in the US back in the 60s. So before this time, anybody who was deemed to have some sort of mental illness or a psychiatric disorder was put in a mental hospital or a psychiatric hospital in an inpatient setting for often years or decades and sometimes their whole lives. And, before this point, I think researchers started to realize and people started to realize that being hospitalized on an inpatient basis over long periods of time was not beneficial for people, and that people actually do better when they're in their own social settings, when they're around their family or their friends, when they're able to work or be productive in other ways, or just when they're out in society, people tend to do better. So At this time in the 60s, there was a big movement to release people from psychiatric hospitals and have them taken care of in community settings. So federal dollars were put into community mental health centers, into job training programs or employment support, and different kinds of services to help people with severe and persistent mental illnesses to be able to function in society. What happened, though, is that there never were enough federal services, and certainly not enough to spread around the entire country and have in all types of areas, including rural areas. And so what we started seeing, and since then what we've seen, is that people with severe and persistent mental illness often have trouble accessing care. They have trouble accessing the supports they need to remain employed or to get employed in the first place. And this led to the increase in what we see now as homelessness for people who have severe and persistent mental illnesses. So as this happened, and as people who had severe and persistent mental illnesses were just, unhoused in communities and unable to access care, then we started to see increases in this particular population coming in public libraries as places to seek respite or be able to stay during the day or be able to get warm in the winter or cool in the summer. We also have seen a lot of economic changes in our country over the last few decades. The Great Recession and the mortgage crisis that started happening in around 2007 brought an increase in poverty-related challenges throughout the U.S. These challenges have continued to increase, especially over the COVID pandemic and the things that are happening now. We've just seen increases in the number of people who've had significant poverty-related challenges, which again has led to many people with poverty-related challenges seeking help in the library or showing up in the library with different types of needs. We don't have enough shelter or emergency shelters for people in our country. We've seen just increasing inflation and increasing costs of living with stagnant wages. The minimum wage has been the same since 2009. And I apologize, this is the statistic for Indiana. It's actually higher in Kentucky when you look at the bullet there about the current living wage. So the living wage for Kentucky is higher than the one that you see here for Indiana, meaning that a single person with no children has to make at least $15.79 an hour to just be able to pay their expenses of daily living. And if they have children or other dependents, the income that they need to support themselves goes up considerably. We also have seen an increase in municipal statutes around the country that criminalize homelessness or criminalize panhandling or loitering or people that are sleeping in public spaces. These kinds of things have also led to an increase in people who are experiencing housing instability or other kinds of needs, needing to go somewhere during the day to be safe. And often that place is the public library. And then the pandemic that is still ongoing has led to a number of increased poverty-related challenges, but also increased mental health challenges, increased intimate partner violence, increased substance use. Lots of other kinds of challenges have accompanied the pandemic that we're in now. In Kentucky specifically, most counties in Kentucky are considered a shortage area for healthcare. So again, this leads to changes in who is coming in the door and what kinds of needs they have when they come in the library. We have a huge number of people throughout Kentucky that cannot access the needed medical care that they need. The entire state of Kentucky is considered a shortage area for mental health providers, and these are classifications by the federal government that are based on the population and then the number of providers in that area. And so the whole entire state does not have enough mental health care for the population in Kentucky. Homelessness is also a problem in Kentucky. So in 2020, the annual point in time estimate found an estimated 4,000, slightly over 4,000 people who were homeless on any given day in Kentucky. This count that is done annually is always considered to be an underreporting of the actual number of people who are experiencing homelessness, because it's just whoever people could find and locate and count on that particular day. It's kind of a snapshot in time, but there often are people that that can't be found by the people who are doing these counts, or people who are couch surfing or staying with friends or family who may not be in the count but may actually be unhoused or not have stable housing. Over 19,000 children in Kentucky public schools experience homelessness during any specific year. There's a shortage of affordable rental homes in Kentucky. And of Kentucky residents that have housing, over 30% are considered extremely low income. 30% of renter households are considered extremely low income, which means that maybe they're affording their housing, but they're going to have trouble affording medications or food or other kinds of care. So again, all of these things impact who's coming in the public library and what other kinds of needs they have that are showing up in your spaces. We also know that the majority of Kentucky has pretty high poverty rates. And you can see here, of course, in Eastern and Southern Kentucky and parts of Western Kentucky, we see really high poverty rates. That poverty guideline is also really low. So if you think back to the slide I showed about a living wage, the living wage is way above the actual poverty guidelines or that poverty line set by the federal government. So again, this map just captures people who are living at or below the federal poverty guideline, which was a family of 4 making $26,500 or less. And we know that there's a huge group of people that make more than that, so they're not captured in that statistic, but they don't make enough to be to have a living wage and to really be able to afford everything they need to take care of themselves and their families. So all of these things have led to what we've seen in research over the past few years, that is this growing number of library patrons who have what we call psychosocial needs. And psychosocial needs are any kind of psychological or social or environmental factor that's associated with chronic stress or strain in general populations. So these are things like the social determinants of health, poverty, not having transportation or childcare, or things like that. These also include social isolation, mental health problems, substance use disorders, or substance abuse problems. So in recent research, we know that these needs of public library patrons have been increasing. The top areas of library patron needs right now are homelessness or unsafe or unstable housing, mental health challenges, substance use or overdose that's happening in libraries, and then general poverty-related needs. Libraries that serve large numbers of people who are unhoused also see larger numbers of people that have these other kinds of needs. So in research that's looked at all kinds of psychosocial needs of public library patrons, we've seen that patrons that have unsafe or unstable housing are more likely to also have mental health problems, substance use disorders, these other kinds of poverty-related needs, and often have really complex and complicated and interrelated challenges and needs. These needs are expected to continue increasing over these next few years. They've been increasing due to the COVID pandemic. And although the frequency of needs varies, recent research that compared rural and suburban libraries to urban libraries has found that libraries of all types see significant numbers of patrons with these kinds of challenges. So in most of the literature that's come out or in the media attention, a lot of it has been on urban libraries, but we know that rural libraries also see significant numbers of patrons with these kinds of psychosocial needs. And many libraries have started adding programming services or collaborations to try to respond to these kinds of needs. We also know that we've seen a huge increase in library worker trauma that often is related to serving some of these high needs patrons and the challenges that are happening in libraries. And we know that frontline library workers from all types of libraries, urban, suburban, and rural, report high rates of trauma from workplace incidents, and over half report experiencing violence in their job. These incidents include things like verbal abuse, physical aggression and attacks, threats of violence, sexual harassment, being threatened with weapons, and having somebody come in and destroy library property. These incidents have been increasing with the COVID pandemic, and again, we sort of expect them to continue increasing for a while. And some library staff actually experience symptoms of post-traumatic stress disorder or the worsening of a pre-existing mental health condition because of what they're experiencing in their job. So one thing that has been happening across the country to try to address both the growing number of of patrons that have psychosocial needs, as well as this increase we're seeing in library staff trauma and workplace related stress, is putting social workers in libraries. And although it's still a relatively small number nationally of libraries that have social workers, it has been rapidly increasing, especially over the last year or two. So there's been a growing movement to partner social workers with libraries. There are lots of different models. This looks different in almost every library, just because library contexts and resources and the community a library is in are very different. And this is not to say that libraries are becoming social service organizations. And in fact, the social workers that are there are often still connecting people with resources and information and doing things that still fulfill a library's mission. So there's still a line drawn there. They're not becoming social service organizations, they're still libraries. And instead, the focus is really on addressing these different types of information needs that are coming up with patrons and seeing relationships as the new reference collection to be able to connect patrons to these resources. A lot of times, I find in my work, because I work at this intersection of social work and libraries, that often on the social work side, people don't really understand what public library work is or what a library looks like right now. People have these stereotypes of what libraries do. The same thing is true on the library side when we're talking about social work. A lot of times people in the general public don't understand social work and what we have to offer and how we collaborate or intersect with libraries. So the primary mission of social work is actually really broad, and there are social workers that work in a variety of areas. And a lot of times people know of child protective service work, or they may know that social workers do therapy, but it's social workers are sort of invisible sometimes in some of these other settings to be able to know what else we do. So the primary mission of social work is to enhance human well-being and help meet the basic needs of all people, with a particular attention to the needs and empowerment of people who are vulnerable, oppressed, and living in poverty. A historic and defining feature of social work is the profession's dual focus on individual well-being in a social context and the well-being of society. So part of what all social workers are trained to do is to work across different levels, so that we're trained to work with individuals and to use clinical skills and assessment with individuals, but we're also trained to address what we call the macro level of needs and look at organizational needs and challenges, look at community level needs and challenges, and also try to intervene and bring about some changes on that level. So when we look at libraries and library work versus social work, we actually see a lot of overlapping professional values. So both libraries and social work share a commitment to service and serving others. We are equally committed to privacy and respecting people's confidentiality. We want to make sure people have access to accurate information and that they can access the information that they need to make their choices for themselves. We respect people's individual rights. We have a strong emphasis on professionalism, on operating with integrity, and we focus on social justice, and again, trying to make sure that there's equitable access to resources and information. The one key way that we really complement one another is that libraries have a focus on serving the whole public, and social workers have a focus on serving the most vulnerable and oppressed. So often libraries, when we look at what's causing stress in libraries, it's the fact that some of these high needs patrons take a large amount of time and really cause a lot of strain for a library worker who's trying to meet the needs of everybody in the space. And social workers are really, it's our professional mission and obligation to serve people who are in poverty or are the most oppressed. So in libraries, we see that these partnerships tend to work really well as long as there are some steps that happen first to really pave the way for the social work program in a library. But we work together well because libraries are really these safe, stigma-free spaces where people can come to access resources. They're safe spaces for everybody. They really operate as these third spaces where people can build relationships and feel comfortable and spend sometimes a great deal of time. However, library workers are trained primarily to connect people to resources for their immediate needs and questions. And social workers are actually trained to look beneath those immediate needs to see what might what broader issues are happening that might lead somebody to need what they need now. So we're all trained to work across this micro to macro continuum of services that I was talking about. So we're trained to work with individuals and organizations and in communities. We're trained to try to foster independence and to be wary of things that might create dependence on us. We are trained to assess needs at a broad level of needs and to try to help move people towards change in their lives using broad and brief interventions. In libraries, we see some social workers or social work interns that are working on the micro level. So they're working with individual patrons, connecting them with information, making referrals to things they need in the community, intervening in some sort of crisis, or doing some sort of case management. And that model of social work in the library is what's getting the most media attention. It's having a social worker who actually works with individual patrons. But we also have social workers in libraries who are working at what we call the meso level, which is the group level. So these social workers are often facilitating programming or workshops for patrons on different types of psychosocial needs like mental health 101 or recognizing substance use disorders or things like that. They might facilitate non-clinical or mutual aid support groups in libraries. They might facilitate book groups on books that are related to psychosocial needs, or they might be training staff and doing staff training sessions on boundaries or self-care or things of that nature. We also have social workers in libraries who are doing macro level work. So their work is really at the organizational and the community level, where they're looking for gaps in services in the community. They're participating in or organizing advisory groups or task forces to try to address things that are happening in the community. They might be advocating for changes on the community level that will better support individuals with different needs. And they also might be doing things in the library, like analyzing policies to look for things that are causing inequities or disparities in patrons. There are existing models of social work and library collaborations. So from the left to the right, we sort of see the least intensive to the most intensive. So on the left, a lot of libraries have some sort of designated personnel that maintains relationships with community partners, tries to keep a resource list updated to hand out to patrons or staff. We see libraries moving to the right on this arrow that have community partners or social workers who come in and hold office hours in the library, maybe one day a week or a couple days a week. We see a growing number of libraries that have social work interns in the library who do time-limited projects or might do some of these micro, meso, or macro level things that I was just talking about. And then we have a growing number of libraries that have actually hired or contracted on-site social workers to work in their library. Social work students are often the first step for a library that eventually wants to hire their own social worker. We do see a lot of libraries that are adding interns to be able to provide these services, to sort of try out these services. They are inexpensive, and students can do all of those kinds of things I talked about, although there are some challenges to talk about with that. And then students often are asked to gather data as part of their internship that can then help that library write a grant proposal or justify hiring a full-time social worker in the future. So a lot of times libraries are using students first on their path to being able to hire or contract a social worker in their space. There are a number of challenges though with students. So yes, they don't cost anything in most cases, although sometimes people have to pay something for the supervision that they need. But there's frequent turnover. Students are there for one semester or one academic year. They have to be oriented for part of that time and then they move on. And so you start over with new students every year. There can be gaps between student placements depending on that school's timeline for when they place students in internships. So sometimes there's a semester between when you could have a student. Sometimes there could be a year or more between when you could have a student in your library. Students cannot operate independently like a professional social worker can. They're going to need supervision. Sometimes that piece can be challenging. And then some libraries, of course, don't have a social work program close to them. There are a lot of collaborations happening around the country. There's a map online on the website wholepersonlibrarianship.com, which shows the blue marks on this map are where there are social work students. Green ones are where a part-time social worker from the community comes in. Orange is when somebody's coming in and having office hours. And then the kind of hot pink or red dots are where libraries have full-time social workers. There are a couple common misperceptions for libraries that are adding social work interns or hiring social workers. So sometimes libraries think that once a social worker is there, there really won't be any more quote problem patrons. So whatever the issues or challenges are there. So they might think that there won't be any more patrons who are homeless in the library, or there won't be any more patrons that have mental health problems. So the social worker can only do so much, and they don't have a magic wand. And there are lots of structural challenges in a community that impact how many people are experiencing these challenges and able to access help for these challenges. So I just always want to make sure that libraries are clear that that social worker can help address these challenges, but they're not going to make the challenges go away. There's also a misperception sometimes that the social work student or a social worker can provide security in the library or provide a similar kind of function or fill a similar role. Social workers are not trained to provide security services. So we can help sometimes with de-escalating somebody that's starting to get upset about something, or what I call pre-escalation, which is preventing something from even escalating in the first place. So social workers in the library can reduce the need for security, but the social worker themselves does not operate as security and can't intervene if somebody's in the library becoming violent or threatening harm in some way. There also is a misperception sometimes that the social worker or the social work student can just fill in different library roles, and that a social work student is sometimes a way for a library to get free help with other kinds of roles that they need filled. But the social work student and a social worker have a very particular role that they typically play in a library, and they can't fill in other places. And then oftentimes people think that having a social work student is going to be the same as having a paid social worker. And for lots of the reasons I just listed, it is different hosting a student, and they can do some things, but they're not going to be able to do everything that a professional social worker who has, experience and has graduated and is licensed, for example, can do. So I'm going to turn things over to Rebecca and Ahmed to talk about their experiences with hosting students this year at LFPL, and then we'll talk a little bit at the end about what you can do if you're interested in hosting a student.
Thank you, Dr. Waller. So we're just going to briefly talk through our experiences with the project, and kind of just starting with a basic project overview. So going through kind of the phases that happened before we actually had students on site to when they were on site, and then current as we're kind of wrapping up this first pilot group. So I'm going to let Ahmed kind of talk about his part to start.
Thank you, Dr. Waller. Thank you, Dr. Bloomer. So as I mentioned, I started my new position. It was around maybe a year after COVID. And I just wanted to assess the community's needs before creating programming. That was my job, to create programs for immigrants and refugees. But one of the things that I remember learning in school was, instead of creating programs that I think are cool, which I had some cool ideas, it was to speak with the people that I'm creating the programs for, and based on what they say and based on those needs, I would create programs that hopefully address those needs. So that's where this whole thing started for me. Even there will be more talked about in terms of resource navigation that we came up with later. But the whole thing started with the needs assessment. So I went out, I talked to maybe my supervisors and administration at LFPL to see how we can go about this. At the time, the LFPL did not have the capacity to do this work. And so for a couple of months, I didn't know what to do. Eventually, I was able to come up with the idea of maybe collaborating with community partners. This would include Kentucky Refugee Ministries, a resettling agency in the city of Louisville. They were not able to do that. They didn't have the capacity. Eventually, I was able to connect with Dr. Bloomer to discuss how maybe we can go about this and creating the needs assessment to obviously find those needs. Dr. Bloomer?
Yeah, and so as we were kind of talking about the needs assessment component, we were also talking about the idea of social work practicum students coming from a field background, working in higher ed with social work practicum students, just the ways that social work practicum students can benefit from different types of placements. And so we kind of decided that we were going to move forward with, in addition to the needs assessment, also attempting to coordinate the placement for the students. And so another initial piece was establishing kind of that structure of roles and responsibilities between the task instructor and the offsite field instructor. So in order to have students, you have to have a social worker with at least an MSW and at least 2 years of postgraduate social work experience. And while Ahmed had some postgraduate experience, he didn't meet the requirements quite yet. And so we kind of talked about what our different roles and responsibilities would look like within that partnership if we were to host students. And while you can do a needs assessment without funding, with our particular populations, we were really looking to get input from the immigrant and refugee communities as well. And so there are definite barriers in terms of interpretation and translation. So we did go through the process of kind of seeking research funding. That way we could have money to make sure that we made it as accessible as possible to different types of patrons, different types of populations that might want to access the library but be prevented due to a variety of barriers. And then in that pre-phase, we were also going through the process of interviewing students and identifying the students that may be a match for the different learning experiences that the library had to offer. So a big thing with social work placements is not just taking the first student that's sent to you, which can be enticing, but making sure that the student's goals for the learning experience match with what it is that you have to offer. And that's just to make sure that the placement goes as smoothly as possible as you're moving through it. So we did find the students that were a good fit. They're here. They're going to talk a little bit about their experiences and challenges in a couple of slides. But once they started, there was an intentional onboarding for students in terms of the center understanding what it was that they were going to be doing, kind of acclimating, because the expectation also can't be that they're just going to jump right in and start doing the work. There has to be a very intentional orientation to the projects that have been developed and what it is that they're going to be doing. So, Ahmed, if you want to talk about the integration into the library itself.
I got you. So I think this is one of the most important things that I was doing in the beginning of this work, and that is integrating the social work students into the library system. And of course, there are two things. There's the branch that I worked at, that we are working out of, and then there's the system itself. I think it was a lot simpler to integrate the students into the branch itself. We're still working on the system integration. But some of the things that we've done in terms of integrating the students is I was able to talk to the library staff about the project before things began happening, and explaining what it means for them, the aims of the project, the expectations. I also want to try to ensure staff act as a resource for students and understand what the students can do, what they cannot do. An example of one of the things that they can do is they cannot provide clinical services, they cannot treat, diagnose, do any of those things. We also talked about boundaries between like what the students can do and what the staff can do and how they can help each other. I was also able to introduce the students to the staff at the branch. That was really nice because they get to know each other, build rapport right away. We were also able to reach out to some community partners serving similar populations, immigrants and refugees, to hopefully attempt to coordinate shadowing opportunities and attend a meeting as well with community partners. So community meetings. This is all to better understand the needs, the experience providing services, the needs of the community partners, maybe find out what are the gaps where they need help, where we can come in to fill in for them. And with phase 3, I will talk about, let's see, these social work and library resource navigation. It's not on this slide, but essentially we had to identify the scope of services provided by students. We also worked on developing tools for intake, screening of patrons, as well as the process for accessing services, scheduling. So how do they contact us? Phone numbers, emails, even created a WhatsApp because that's something that's commonly used with immigrants and refugees. We identified agencies to collaborate with a specific focus on immigrants and refugees, agencies that serve immigrants and refugees, but also social services that are available to the general public. And then we also looked for partners to refer clients for services. So the students, Beth talked about this a little bit. The students are not going to provide all the services in-house. There are some things that they can do in-house, maybe filling out applications and so on. But there are things that we would want to refer to those who are experts in terms of addressing those needs. Dr. Bloomer?
Yeah, and I think it's important to acknowledge we moved away from calling it case management. Of course, with the students, when we were talking about what it was that they were going to be doing during the interview process, we kind of referred back to case management because that's a kind of a social work term. But within our specific community, the concept of case management had taken a negative connotation in some ways. And so in order to make it more accessible and to make it something that had less stigma, we're focusing on calling it resource and health navigation. Because really it isn't our goal for us to replicate the services that already exist. We're just trying to catch those individuals that are falling through the cracks because there aren't enough resources for the agencies that are serving them already, or they're not connected to those agencies. So I just wanted to mention that aspect as well. And so in some instances, you do the needs assessment prior to the micro practice, which can be very helpful. But we did it simultaneously. And so the students had the opportunity to create the policies and practices for the resource navigation, as well as engage in this community needs assessment creation. So there was the process of researching existing tools. So looking at other reliable, validated survey measurement tools that were assessing specific things. So we had certain types of psychosocial well-being that we knew might be areas of need for these populations. And so we were looking to have some tools that we knew were already tested to implement within our survey. And then we created the questions, compiled everything, and we're in the process of implementing the survey currently. We're also doing focus groups, so creating focus group questions and implementing those focus groups with English language learners. So we have 4 focus groups with 4 different languages that we're going to be implementing as well. And as Dr. Waller was talking about the different types of tasks that students can do, this is just an example of the types of services that the students at the Iroquois branch were able to do. So within that macro scope, they were able to kind of look at the existing organization services that were provided by those organizations and develop a menu of resource navigation services. So what is the scope of this project? What are we able to help people with, and what are we not able to help people with, and we need to refer out to someone else? Making sure that as we're creating our policies and practices for this project, that they're trauma informed, and that we're making sure that we're being culturally sensitive in the work that we're doing. So they co-created all of the survey instruments as well as the focus group instruments. They're able to provide resources to library staff. And then they've also been able to engage in like writing grant applications and looking at different kind of macro funding opportunities that might be out there. In terms of micro, they've been able to interact with patrons on site and shadow case managers at community agencies. So because this is a new pilot project and there's not a full-time social worker on site doing resource navigation for them to shadow, we partnered with community organizations that were providing similar types of services. That way they could have access to learning more about that. And then attending meetings with community partners and providing the navigation for patrons. And then if Alara and Shukri are able, they're going to go through their own challenges.
Hi, everyone. Can you all hear me?
Yes.
Yes.
Okay. My name's Shakri. I am currently placed at the Iroquois Library, and I have my bachelor's in social work, and I'm currently pursuing my master's. Alara.
And hi, everyone. My name is Alara Gillum. I received my bachelor's in Latin American and Latin Studies and International Relations, and I'm currently also pursuing my master's in social work.
So at our placement, I really enjoy it. It's given me the opportunity to kind of be engaged in like what a non-traditional social work setting looks like, and this has helped me like strengthen my skills in terms of like knowledge and expertise, like as a social worker. Um, I also enjoy it because I get to build familiarity with the patrons that come to the library. I go there every Wednesday from like 1 to 5, and seeing different patrons and seeing a lot of familiar faces has been good. It also has helped in terms of like our like engaging with the patrons in terms of our needs assessment, like learning what their needs are and like translating what their needs are like in grants we apply for, and just trying to best support like the patrons who we work with, and trying to further the like access to resources they are receiving. And it also has helped me in terms of collaboration. So working with different community partners to build our clientele and also like work with them to like relieve their capacity in terms of like their caseloads. And we also work with different social workers that are placed like in libraries around the world. And like this just like helps us like build our resources and also like just build community in terms of like what we're doing. It's also helped me with my communication, like learning the different cultural patterns and what's relevant and how to navigate engaging with patrons. But yeah, overall, it's been a very great experience for me. And Alara, if you want to go ahead and share some of your positive strengths.
Yeah, I think the library has been a really beneficial placement for me. I haven't anybody who's asked, I haven't had enough positive things to say about being able to be in the community and serving in such a flexible capacity, being able to work with direct practice with patrons, but also working with the staff and impacting the community on macro levels, and being able to change policy and create new programming has been a really wonderful thing about this placement. And I hope it's been a really beneficial thing for the library as well, to be able to have social work students and to be exposed to the kinds of work we do, and to be able to integrate the great things about the library with also the wonderful things about social work in order to serve our community the best we can. But I think one of the most important things that I've gotten from being in the library is just the flexibility. Being a social work student in a practicum placement, it's really important for us to be able to have the different experiences from being on a micro level, getting that direct service practice, with also being at a meso level, working with groups, and then on a macro level, serving the community. And so I think just being able to gain a wide variety of skills through this placement has been a really special aspect. But that's not to say that it's come without challenges. As you can see on our slide, we have experienced some challenges being in the library. The first of which is our limited ability to serve patrons. Being in the library, I'm there on Mondays and Tuesdays from 1 to 5, and Shukri, as she said, is there on Wednesdays from 1 to 5. Um, and we can't serve as many people with 10 to 15 hours a week as a full-time staffer could, or even a part-time staff, social work staff, being in the library, providing that resource navigation. And so there's definitely a challenge there, trying to provide really quality direct service, but also understanding that we're students and have a lot of other responsibilities at the same time. And so noting that for sure. And then another challenge that we have faced is the limited private space to serve clients. Ahmed is wonderful in being able to leave us his office for whenever he is doing outreach in the community in order to give us that space to meet with clients if they wish to meet privately. But if Shukri and I were there on the same day, or if a library were to host multiple students, there are only a few rooms that we can discuss private information safely and confidentially in order to protect the clients and their needs and the things that they're sharing with us. And so definitely thinking about that, if a library were to host students, of where they would be and where patrons could confidently and safely share their needs with social workers. And another challenge is the lack of understanding. Library staff have different trainings and can be unaware of the role, knowledge, and expertise social work students hold. I know that there were a few slides speaking about the common misperceptions and things that a social work student or staffer could do if they were placed in a library. And so I think it's really important for staff to know the differences between social work and library education. And so that's definitely been a challenge for us that we have been able to work through with the staff at the Iroquois branch. And then the final challenge that we've experienced is just being a pilot program, being the first students in the library in Louisville. There has been a lack of integration just as we learn how the program should work and to set up the program really well for the future students. There was no established referral process for us. If we received a client that we couldn't give services to, what's that process going to look like for us to send them elsewhere? Who are we going to contact? Do we have the resources to be able to say, yes, go to this place, so and so can help you, here's their number, here's when they're available, here's what they can do. There was also like just simple things of integration, just like there was no name tag for us at the beginning. So sometimes it felt like if we were being called to help a patron, it just felt like we were just another patron that was called off from a table. And so yeah, just being able to have that recognition and that name tag to say like, yes, like we're here to help, we're part of the library. And then to also have signage in the library posted to say that the service is available. Yeah, this signage or an area for patrons to know of the program being offered. And Shukri, if you're back, if you want to add anything to the challenges you've experienced being in the library.
Yeah, I can just briefly touch over them again, but yeah, so as students, we only have like 10 to 15 hours a week on like how we can serve the patrons, and sometimes patrons come like during like different hours, so like we're not always at the library, so that's been a challenge itself. But we basically like for example, yesterday, like someone told me about a problem that a patron was experiencing, and then like I came up with resources for that patron just in case they come again. So it also has been a benefit in some way, like just in learning like how to navigate that, and just like bridging the gap of like our hours and things like that. Also like, yeah, in terms of like limited space, so we're like upstairs, but like sometimes Ahmed's in the office, and then so we can't take the patron down, so yeah, we don't have like an established space, but it's been pretty well like working with them in terms of that. But yeah, that's what I got.
Thank you both for sharing your insights into the placement. I do have this slide, but I know that we're short on time, so I'm going to go ahead and pass it back to Dr. Waller and let her wrap up what she has, because I know she's going to also touch on some of these areas.
Thank you all for sharing your experiences there in Louisville Free Public Library. Hopefully that's really useful for everybody to hear. So for all of you who are thinking about hosting your own social work student or are interested in this, you got to hear some of the experiences from that particular library and those students about some of the challenges and some of the work that needed to be done first to really set the stage for this. So I'm going to go through these really briefly. You all do have access to the slides as well as some links to some additional resources that give you more information if you're interested in this. But first, I would say before you ever actually initiate the placement, really think through your goals. So the program that they just talked about was very focused on refugee and immigrant services and needs. In other libraries, sometimes the focus might be people who are unhoused, or might be really broad, or might be senior populations or youth. So it really is about the goals for your library and what kind of needs you need to fill, but also what do you have to offer the students. This is a learning experience for the student, not just like it has to be a mutually beneficial opportunity where the students are going to be able to learn and practice social work skills while it also adds to what you're able to offer and serve, the people you're serving in your library. So we do want to say the final bullet point on this slide is really important. The first time students are in the library, we really recommend that you focus more on those macro issues. So sometimes libraries are in a hurry to have somebody in there to work with individual patrons. But really, before that work ever happens, it's best to have students focus on the needs assessment, really designing some of what the program will look like, the protocol, how things will work. So that first placement works better when it's focused more on the macro challenges or the macro needs before having students work directly with patrons. You should reach out then to your local, whatever the closest school of social work is to you. You can ask for the field director or the program director. Find out from them what the timeline is for placement, the process for having students placed in your library. You also need to leave time for the legal affiliation agreement. So every school is required to have an affiliation agreement with the places where they're placing students. And in some libraries and with some universities, that can take some time to actually work out. So just make sure you leave time for that. You do want to prepare staff, make sure everybody's on the same page about what these students or this student might do. Really talk about some of these examples of social work and library collaborations and what you hope to get out of this placement. As I think Dr. Bloomer was talking about, it's really important to not take the first student that comes your way and really go through the process of interviewing potential students to determine who's going to be the best fit for your library and your needs. It is better in our experience to have no student at all than to have a student who is a really poor fit for a library-based placement. The two students were talking about their experiences at LFPL, and this is a great environment for what we call generalist social work services. It's not a clinical placement by any means. And so it's important to have students who really know what the placement is going to be and want that as part of their learning experience. And ideally, you want a student who can work pretty independently since they're not going to have regular on-site social work supervision all the time. And you want people who have some experience and some knowledge of community resources. You do need to think through who from your library will be their supervisor. They need one main supervisor from the library as well as their social work supervisor. And those two people will really need to work together and collaborate to give consistent messaging to the students. You want to take time to orient them to the library. There are some resources there on this slide that give you some things to have students do as part of their orientation, but they need to get familiar with the library setting and what library-based social work looks like before, again, they're ever serving patrons. You also want to think through the learning requirements. So all students have to meet certain competencies for social work education, and they need to do things in their library placement that address each one of those competencies. And there are some examples. You can see the competencies here, and again, you can read those later, but there are some resources that are shared at the end of the slides where you can find examples of library-based learning activities students have done that address each one of these
last slides,
competencies.
Angela, she's just flying.
And then you
through 'em.
also want to
So,
think
like,
through the
there's-
evaluation.
I can't keep up with her.
You want to think through the evaluation piece and how that student is going to be able to evaluate their learning, and then how you will evaluate on your end whether it's productive for you as well as for the student. And these resources are all in the chat as well. So I know we've gone really fast. We are out of time. We have left all of our email addresses there on the last slide. If you have questions for any of us, please feel free to send them to us, and we can talk with you that way to answer your questions. So I'll turn it back over to Hillary, I guess, to close it out, or we might have time for one quick question if there's one quick one.
Well, thank you to all of our presenters so very much for all this information, for the students presenting, Dr. Waller, Dr. Bloomer, Ahmed. I think we had a lot of information here to share. If you have any questions, I've dropped the presenters' emails in the chat. You can follow up with them. I am going to put my email in the chat as well. so you can follow up with me, and happy to connect you. I do ask that I'm going to stop sharing this slide and note that this was offered through the Institute for Museum and Library Services. I want to thank them for providing the funding to allow this, as that slide's coming up. And then I also want to request that you all, if you're able to take a survey letting us know feedback on this webinar. So I will quickly drop that in the chat. Thank you all so much. If you have questions, I think we're going to have to cut off the webinar, but if you do have questions, please feel free to follow up with me, and I will get those questions to Dr. Waller and or the other presenters. Thank you. Thank you. And I'll hang on here just a few moments if folks want to ask questions, but I know that folks have time commitments, so if you need to leave, certainly feel free to do that, and you can email me later. Thank you again, Dr. Waller, Dr. Bloomer, Ahmed, and Alara and Shakri.